Thank you very much. I want to thank the Quality and Outcomes and Safety Committee for the invitation to talk. My topic is OR team training with simulation. There we go. So I often give this version of this talk, and I like to call it bringing high reliability to the operating room, because that's what we're trying to do. We're trying to create highly reliable OR teams in order for our teams to be highly reliable so we can become the high reliability organization that the patients and the public want us to be. I also am very happy to be part of this because I think we're right on target with the theme of the SAGES 2014, looking at patient first and safety, and this is titled OR Safety 101. I have some disclosures, co-editor for simulation radiology. I don't think I have any impact on this talk, and then a lot of these things I'm talking about is we were able to do through funding opportunities. So what's the goal of my talk? Basically, my goal is to promote adoption of simulation-based training of interprofessional teams to enhance collaboration, teamwork, and patient safety. I have three learning objectives for y'all. We're going to discuss the current status of teamwork. I'm going to expand a little bit more on what both Drs. McCary and Dr. Earle talked about in the OR and its impact on patient care. Then I'm going to illustrate high reliability and team function, how to apply it to the OR, and then describe our simulation-based team training program and its role in promoting teamwork. But first, I know it's the afternoon of the first day here. It's been really long, so I have a quiz for you, a little riddle, and it's in honor of March Madness. So I have a picture of three things here. I've got a modern-day OR, modern-day commercial airliner, and then that was the Superdome 2 years ago for the Final Four. And the question is, what type of experts work in each of these environments? So I want you to think about it a little bit, turn to your neighbor and say what you think the answer to this riddle is. I don't hear any talking. So tell your neighbor what you think the answer is. So basically, it's a team of experts versus an expert team. And my contention is we have a team of experts in the OR. We're all experts here. You're an expert in what you do. But when you get into the OR, you're really just a team of experts. You're not working like an expert team like commercial aviation or a championship team is. So let's talk a little bit about background in the, and talk about teamwork in the OR. So this is what's wrong with the OR team today. So I have a picture. I'm from New Orleans. So these are Mardi Gras Indians. They come out on Mardi Gras Day. But what are Indians? It's all about tribalism. And how do we get that tribalism in the OR? It's because we live in silos. And that's what's wrong with the OR today, because what it fosters is a multi-professionalism in lieu of an interprofessionalism. And again, it's that team of experts in lieu of an expert team. This is Marty's work again in a different version for you. So basically, if you're focusing on the surgeon, you ask the surgeon, how is teamwork in the OR? You look at these numbers, 80%, they think it's great. 80% is great with the nurses. 80% of surgeons say it's great with the nurses. They say 84% of surgeons say it's great with anesthesia. Now look at those same numbers when you ask the other person. If you ask anesthesia or nursing, 48% of nurses thinks it's good with the surgeon. 70% of anesthesia. So there's a disconnect, as Dr. McCary illustrated, and this disconnect causes problems. Another thing is, more recently, you can say, well, he did that research a while ago. But this is from 2011, and there is a large rate of dissatisfaction among the other professions in the OR. Surgeons think it's great. Why shouldn't we? We're in charge. We've been running things the whole time. But the other professions are dissatisfied with the teamwork. So what happens? What does this do? Well, the other problem is you'll get problems with communication. Say a surgeon asks for something. Lingard did a great study. This is from 2004. She showed that 30% of communications in the OR are failures. Think about that. 30% of the time when you have a communication in the OR, it doesn't work the way you want it to work. You can say that's old data too, but more recently, Halverson looked at errors in the OR and found 56 communication errors over 76 hours. What does that mean? That's about almost one communication error per hour of operating. Then Sevdalis has done some work. He noticed that surgeons initiated communication about 80% of the time, but 50% of the time it really didn't work with the first assistant, and it didn't work with the scrub tech either. So again, we're having problems with even talking with each other in the OR. So how are we going to be able to function well? Can you put on the audio, please? So this is a variation of what Dr. Earl showed. This is the classic, if they can put on the audio.
I didn't even mention a guy's name on third base. Yes, you did. All right,
I'll see if I can start it over a little bit. So this is the famous who's on first. So here you go.
On a team. How could I mention a guy's name?
You did. You just mentioned it.
All right, what's the guy's name on third base?
No, what's on second?
Who's on second?
Who's on first?
I don't know.
He's on first.
See what I mean? I didn't even mention a guy's name on third base.
Yes, you did.
All right, then who's playing third base?
No, who's on first?
I'm not asking you what's on first.
What's on second?
Who's on second?
Who's on first?
I don't know. He's third base. Third base. Third base. I don't know anybody on a baseball team.
You do. You mention their names.
I do?
Sure.
You got an outfield?
Well, naturally.
The left fielder's name.
Why?
I just thought I'd ask you. I just thought I'd ask you.
Well, I just thought I'd tell you.
Well, go ahead. Tell me.
Tell you what?
The left fielder's name.
Why?
Because I want to know. Because.
Oh, he's center field. You know these players as well as
Who's
I.
in center field?
No, who's on first?
What's on first?
What's on second?
I don't know. Third base.
So how many people have felt like that in the OR before? So this is kind of what the communication is like. It's just this, you're talking past each other instead of with each other. Can we go ahead? Can you advance the next slide? I'm having trouble advancing the next slide with it. Thanks. So who's on first? Why do we have these problems? What are the problems? So a lot of it's misunderstanding information, information confusion, this ambiguous message, and the hint and hope. The hint and hope is the classic, are you sure you want to do that? This, you know something, you don't want them to do it, or you see something going wrong, but you're not very specific about it. You're not direct in your communication, or the nurse is not direct to you in the communication. And then they're just kind of hinting at it and hoping that you get it through and that the right thing will be done. And then either the information is given too early or it's given too late. I'm not sure. There we go. Another thing, what about the hierarchy? What's the hierarchy like? Well, basically, Andre showed that 75% of team members want to change to the current team structure. It goes back to that other figure I showed you before, where most of the people are very dissatisfied with the teamwork. So who cares? Who cares if teamwork's not that great? Well, there are consequences, and the consequences are pretty severe. One, you have a lot of disruptions. Rosenstein and Daniel did a great study, and they showed that lots of yelling, lots of disrespectful behavior, patronizing, abusive language, this all happens. Over 50% of individuals who were surveyed in this study said they'd had experienced that. The other thing that happens is you get distractions. And so Dallas just recently showed that distractions occur about once every 4 minutes, and the most disruptive ones, the ones that cause the most problems, are the ones where you get the external visitors coming into your OR. So external visitor might be counted as the person who's coming in to relieve for lunch, or lack of coordination between hospital departments, and it has a negative impact on safety. And that's basically leading to what? Tension in the OR. And so you basically have a time bomb waiting for people to blow up because of all the frustration and disruptions. And it's been definitely demonstrated that poor teamwork, this is in the literature, it increases technical errors, lap chole, it increases morbidity and mortality, it decreases patient safety, and then there is some indication, because if you look at sentinel event analysis, that it's actually a major cause for sentinel events, especially the communication breakdowns. So what about high reliability in the OR team? Well, there are lots of challenges to building team building, and I've talked about them, and you can read some of those right there. One is the rigid hierarchy. Another is people have different motivations from the different professions. So how do we overcome that? Well, there's a lot of research out there. Checklists, the WHO checklist has been shown to be very effective. preoperative briefings, as Dr. McCary had mentioned, briefings have been shown to be effective. Even team working, team steps, it's a classic teamwork example. And then high fidelity simulation is another means of trying to promote teamwork. Eduardo Salas has done 30 years of research in team science, and he has come up through meta-analysis and review of the Navy, the Army, other industries. He's found 5 core components of effective teamwork, and you can read them there. They're either skills, attitudes, or knowledge. And they have 3 coordinating mechanisms that help to make them effective and help people be really highly reliable as a team. And they interact in various ways. You can see the main thing is the team orientation, leadership, backup behavior, mutual performance monitoring helps with adaptability, which is the key. You want to be adaptable when things don't go right. You want to be able to adapt quickly and effectively. Team steps is basically built on this. The first 4 are the basis for the 4 components of team steps and the tools that are used in that. We've gone to high fidelity simulation-based training at our institution to try to promote teamwork. We started with an AHRQ grant, which was in situ in the OR. It was high fidelity simulation. It was at the point of care. We had interprofessional teams. We actually trained the entire OR staff. It was what we call the mobile mock OR concept. And we had half-day sessions, 2 scenarios to try to reinforce learning. And then we used these 9 team-based competencies to teach people. Situational awareness, anticipatory response, kind of anticipating needs. Dr. Earl likes to use Magic Johnson. I like to use Drew Brees for the anticipatory response. Drew Brees throwing a touchdown pass to Jimmy Graham. Anticipating where they're going to be on the team, where they're going to be on the field. And we measured teamwork attitudes and culture. Then we took what we learned from there and we came home and we started working with students. And the idea was to try to take what we learned, same format, same type of training, but do it with senior students, nurse anesthetist students, and also undergraduate nursing students. Every session has a pre-brief that sets the tone, makes everybody feel safe. Then we actually do the scenario, and then we do the debriefing, which is where the learning is. So we really try to make it stick and make it last in the debriefing aspect. This is just a little sample. If you can turn on the audio real quick, and I'll give you just a few seconds. No, that's all right. So anyhow, we've expanded it to include allied health pilots, where we bring in physical therapy and respiratory therapy, and then also third year clerkship students in undergraduate nursing. So we're trying to go across all the professions for this teamwork. So what have we found? Well, basically we found that it's great at improving attitudes towards team-based competencies. We also show that people learn, so they adopt the behaviors that we're teaching. We showed some retention of skills, so this lasts for some time. It looks like it lasts up to 6 months. And then we've also shown that there's reinforcement of the attitudes and improvement in team-based attitudes over the course of a year. That's what we showed in our most recent one. But I'm not alone. We're not unique. This has been done. It started in Basel with Texas, and it's all throughout the world. In Melbourne, the Imperial College in London, up where Dan Jones is, his organization, and Brigham and Women's have started the collaborative, and they've done some really interesting work. In which they've shown through simulation that you can use simulation to train people on checklists, and they improved adherence to that. And they've also more recently done work showing that you can bring in entire teams and decrease malpractice insurance rates. So in summary, teamwork in the OR is currently less than ideal. We're not there yet, even though we've done a lot of work trying to improve it. Highly reliable teams possess key team-based knowledge, skills, and attitudes that are teachable. I think that's the take-home message. If someone's good at teamwork and leadership, it's a skill. It's not innate, and we can teach it. And we can use simulation-based OR team training to do that and to improve team function. I want to acknowledge my team. All this work requires a team of individuals to help set it up, and then also the teams that come in and do the training. And to improve what they're doing. My final message is our goal is to get them young. The idea is to do the training while they're young at the undergraduate level in order to try to get people to bring these into the work environment and model them there. Thank you very much.